afternoon, everyone. I am Prerna, and today my topic for presentation is first aid at insect and spider bite. Before I start, I want you all to imagine if someone suddenly gets bitten by a spider or insect around you, what will you do? A teeny creature with eight legs, unnoticed, silent, can literally cause big emergencies, and that's what today my topic for presentation is. Starting from understanding the common bites, what to look for. As we all can see, there is a picture I have mentioned here. Here is identifying the bites. There are the pictures of different types of bite, which are mosquito bite, ant, tick, bed bug, spider, and bee. Identifying the culprit helps determine the appropriate treatment. While most bite results in minor irritation, some can cause severe reactions or carry diseases. There is mosquito bite. Mosquito bite is the most common one if we are talking about insects. Small red itchy bumps which carry immediately. They are the primary carriers of diseases like malaria or Zika. Then we have non-venomous spider bite, small red velvet with two tiny puncture marks, mild discomfort and localizing swelling. General first aid principles for minor bites. Here I have mentioned four which are very simple yet very important ideas for general first aid. First one is clean the area. You have to gently wash the bite area with soap and prevent the infection. By water also you can prevent it. Reduce swelling. You can reduce the swelling by applying a cold compress or ice packs for like 10 to 15 minutes. Elevate itching. You can elevate itching by using an antihistamine cream and avoid scratching. In most of the time when like for example, if our hand is getting bitten by an insect, then most commonly what we do is that we scratch it, right? And scratching can even worsen itching and lead to secondary infection. So also what you can do is like keep your fingernails short. And then this slide is one of my favorite, and these are the home remedies which are quite popular in India. And I bet that some of us, like most of us, have used this kind of remedies at least once in our lifetime. This is turmeric and neem paste. It reduces inflammation. Then aloe vera gel, especially girls, we all know that how beneficial aloe vera is for our skin. And in spite of it, it soothes itching and it also promotes healing. Then we have essential oil, lavender or tea tree diluted for antibacterial effects. Then we have oatmeal treatment, the baths or paste to calm the itching and redness. Then we have when to seek medical help, right? These are 4 points which we will require to know that when we have to visit the doctor or when we have to seek the medical help. First one is severe pain or swelling. If the pain or swelling is disproportionate to the bite or rapidly worsening, then there will obviously there will be signs of infection like increased redness, warmth, pus, or fever developing days after the bite. Allergic reactions. Okay, any signs of severe allergic reaction? Anaphylaxis. Anyone here know what anaphylaxis is?
No.
No.
Anaphylaxis is actually a allergic reaction which happens very quickly. Like if you are having exposure to a allergen. By allergen, you might be allergic to
Dust.
you might have allergy with peanuts or pollen grain or any kind of certain medicine. So that's what anaphylaxis is. And if this thing happened with you, you all have to call 999 immediately, right? We all know what 999 is. What is it?
911.
It's emergency telephone number, so you have to call it immediately. And the fourth one is unusual symptoms. Obviously, we got so many unusual symptoms. If you develop unusual symptoms like you have headache, you have muscle ache, you have joint pain after a bite, what do you have to do?
Seek medical help.
Visit the doctor. Like you have to seek the medical help. And debunking myths, separating facts from the fiction. There are so many myths. I have mentioned the two most popular myths which are very common. First one is ammonia or urine neutralizes venom, but the real fact is that these methods can often worsen irritation or lead to infection. Second one is venom extractors pull all the venom out, but the fact is that studies show these devices are ineffective at removing the significant amounts of venom after a sting or a bite. Then key takeaway and resources. What we can do in such kind of situations. What we have to do, we have to stay calm, we have to act quickly, and we have to prioritize emergency services for any severe reaction. You have to, there are three basic steps which we can follow. Here we have immediate care. Obviously, I have told earlier that you have to clean the wound, you have to remove the stingers by scraping and use the cold compress to control swelling. As I have mentioned earlier, that you have to apply ice pack. Anaphylaxis I told earlier also. There is this adrenaline auto injector, EpiPen, it's also available. Then prevention, use repellent, wear long clothing and be cautious near food and nesting sites for insects. This picture is a very beautiful picture of a family. They are all ready for having
A trek.
hiking at mountains and like in such kind of dense vegetation areas. Insects and spiders are mostly activated. So what we can do, we have to wear long sleeves, as I have mentioned earlier, that wear long sleeves, and you should carry first aid, as I have mentioned that you should carry first aid, and then visit this kind of areas. Opt for long sleeves, especially in areas with dense vegetation or during dawn dusk when mosquitoes are most active. Secure your home, ensure the windows and doors have screens fitted, and repair any holes to keep the insects out. Teeny creatures may cause trouble, but the right first aid can turn panic into protection. Before I end, I want to say something that even the spider and insects are small creatures, but we all should respect this thing and follow all those first aid, and stay prepared, stay aware, and act quickly. And thank you so much for being such a sweetest and attentive audience. I really appreciate this. Have a nice day.